About that time, we can get started. I think the rest of the panelists will probably come in as we're kind of going through the intros. So I think this is as good of a time as ever. So hi, everyone. I'm Spencer, host for this room. Before we get started, here's a couple Clubhouse pointers. You can use the share button at the bottom of the room to share it on social media or directly with others. You can narrow your search using words like sickle cell and try and invite really pertinent people who might want to hear this discussion. We also encourage everyone to use the share on Clubhouse feature. If we can get a lot of people to do it, it'll greatly increase the likelihood that people can find our room and just increase overall traffic. The way you do that is you go to the share button at the bottom and then the share on Clubhouse option. It'll pop up in people's feeds and they might join if they otherwise weren't able to find it. Also, please make sure you check out and follow everyone in this room, including all our moderators and panelists here today. That way you can stay up to date with when other rooms like this are happening. And for everyone in the audience, we encourage you to raise your digital hand and we'll be sure to answer any questions or bring you up to the stage if you have a story to tell. For those that don't yet know Consuli, broadly, Consuli is a public benefit company with the mission to enable individuals to participate in the data economy. Experts suggest our individual data is worth about $20,000 per year. We do this by operating a marketplace for members where we become their agent and assemble patients' health records, labs, prescriptions, wearables, quality of life surveys, etc. Importantly, members receive smart match individualized offers from us for opportunities, including to participate in clinical trials and data trials. There's no cost to join our movement. You can learn more at consuli.net. I'll be sure to post a link as soon as the room gets started. It's now my pleasure to turn the floor over to our room moderator, Elizabeth Dreicer, who's a philanthropist, activist, and co-founder and CEO of Consuli. Elizabeth will be introducing our distinguished guests. Elizabeth, over to you.
Thanks so much, Spencer, and thanks for all that you do to make this event possible, and to all the panelists as well. Welcome. We're honored to host and facilitate this room. And we aim for the room to be interactive, so please engage in the chat, raise your digital hand. We'll endeavor to get to everyone that wants to participate. We'd love to welcome you to the stage. And I think for some of you who know, occasionally Clubhouse is a little glitchy, so if you get bounced out by raising your digital hand, I know this happened not long ago, just come back in and we'll get you up to the stage somehow. I think we've somehow managed to stay persistent and it all works in the end, so just hang in there with us. And as I introduce our panelists and guests, I'd also like to have them share their opening remarks, what they perceive are the core needs in the sickle cell community at this time. First up, okay, I'm adjusting. Thanks, Spencer, for the notes. We're going to take it a little out of order, but we'll get everybody eventually. First is Lupe. Lupe is a Nigerian woman currently residing in Oakland, California. She became a nurse to give patients someone they could relate to beyond a textbook. She started the nonprofit I Fight for Sickle Cell to spread awareness, support sickle cell warriors, and empower individuals to be conscious of their hemoglobin genotype. I'm turning the mic over to Lupe for her opening remarks, including touching on the core needs of the sickle cell community at this moment in time. Lupe, the mic is yours.
Hey, can you guys hear me
Yes,
clearly?
loud and clear.
Okay, perfect. Thank you for the introduction. Hello, everybody. In regards to opening remarks, I believe there needs to be an increase in education amongst the core curriculum for medical professionals, as well as an increase in trait testing amongst communities where sickle cell is predominant.
Thanks so much, Lupe. Appreciate your opening remarks. Okay, next up, Ufoma has lived a life with sickle cell disease and now lives sickle free after undergoing a bone marrow transplant in late 2016. She currently has devoted much of her time outside of academics to pursue her passion for building community. Ufoma is the founder and CEO of Not Just You, a nonprofit sickle cell support organization that is devoted to creating a support system for individuals and families affected by sickle cell anemia disease. Ufoma, thanks for being with us. Over to you for your opening remarks.
Hi, everyone. Thank you again for having me on this platform. There's so many things that I could open with, but I think maybe just in regards to health equity, I think recently I was at a global sickle cell conference, and one of the discussions that I was privileged to moderate was in regards to reproductive health with sickle cell patients. And I also have a passion for like women and gender studies. And it really just showed me that, like, you know, at the end of the day, if we are trying to achieve reproductive rights and reproductive justice within all communities, I think a key way to actually achieving justice in this area is providing adequate resources for individuals affected by sickle cell disease, because not only being marginalized based off of our skin color and how we are treated in hospital, unfortunately, like we're not able to reproduce safely, and there aren't systems and policies in place to make that happen. So I think that is an area for work to be done.
Thank you so much. Appreciate the perspective. Next up is Chris Ruffin. Jr. Chris is the author of Succeeding with Sickle Cell, a practical guide in how to successfully manage sickle cell disease. He's also an Emmy Award-winning producer, a graduate of Stillman College, and is originally from Birmingham, Alabama. I'm turning the mic over to Chris for his opening remarks, including touching on the core needs of the sickle cell community at this moment in time. Chris, the mic's yours.
Hey everyone, can you hear me? Hear me well? I'm in the car right now.
Yes, we can hear you.
Cool. Thank you so much for having me on. I really appreciate you all for joining this conversation and having me as a guest. As Elizabeth said, I pretty much just published a book on my journey with sickle cell within the last couple of years. I'm 28 years old, and you know, of course, been dealing with the disease my entire life. So, recently I was getting calls from my doctor to talk to younger patients about dealing with sickle cell, and specifically the transition going from pediatric care to adult care. And I just thought it would be good to kind of talk about how I've balanced having a job, going to school, and just living my life as an adult and teenager with the disease. I think it's very important for us to reach back and see how we can help others while we help one another, our peers. So I'm down for the conversation. I love what I've heard so far, and I'm here if anybody needs to talk. And if you would like to look at the book, it's about 20 pages. It's an ebook, so it'll be in an email form. And yeah, I'm here to talk.
Thanks so much, Chris. And if you pass that to Spencer, we'll make sure that we get that published in this format somehow. So looking forward to that. Next up, I'd like to introduce Dr. Rowley. Dr. Rowley is a sickle cell warrior, but she likes to refer to herself as a sickle cell gladiator because she sees herself as more than a conqueror. Dr. Rowley is the author and educator and has a children's book on sickle cell called Tanwa. It's launching on June 19, World Sickle Cell Day. I'm turning the mic to Dr. Rowley for her opening remarks, including touching on the core needs of the sickle cell community from her perspective. Dr. Rowley, the mic's yours.
Hi, good afternoon. Thank you. Thank you, Elizabeth. Hi, everyone. Hope everyone is doing well today. Yeah, so Elizabeth said it. I just published a book called Tanwa. It's about a 5-year-old living with sickle cell, and it's just basically tells the reader about sickle cell, takes them through how she navigates life and tries to balance being a sickle cell warrior and being a 5-year-old curious, friendly, fun-loving child. I'm 54. I have 2 daughters that have the traits, obviously, but thank God they don't have the disease. Yeah, I'm kind of tired today. School just broke up for the summer, and I'm trying to catch my breath. It's been a long, 10 months? But yeah, I'm glad to be here. The topic today is about health equity for sickle cell. Well, I've mentioned this on this forum before that I don't think it's equitable, especially when it comes to employment. And everyone has the same number of sick days, and people that have a health condition need those days more than other people. So for equity, those of us that need it should have more than the 7 sick days we're given per year. Yeah, I'm here to chime in, answer questions, and just be part of the sickle cell advocacy journey. Thank you. I'm done speaking for now.
Thank you very much, Dr. Rowley, and appreciate that and appreciate your comments and call for appropriate sick days for folks living with this and really any serious illness. Next up, Brenda Green. Brenda is a mother of 3 from Columbia, South Carolina. She's an engineer by profession and the founder and CEO of a nonprofit called the Be Strong Group by purpose. She founded the nonprofit in honor of her son, Braden, who has sickle cell disease. The Be Strong Group's mission is to spread awareness of sickle cell disease through education, advocacy, and empowerment. I'm turning the mic to Brenda for her opening remarks, including touching on the core needs of the sickle cell community at this moment in history. Brenda, the mic is yours.
Good evening, everyone, and I'm so happy to be here. I think I've expressed before that the core need, as my role with our small nonprofit, is to spread awareness within, we're specifically within our community. And I feel that by sharing and within our community and letting people know, people in our community are our employers, our employees, our coworkers, you know, nurses and doctors. And so if we could share information and educate our community, that's more people that know about sickle cell disease and possibly share what they know, show more empathy. I know it's a general need, but I think the education, the awareness, that's one of the basic core needs within the sickle cell community. Thank you.
Thanks so much, Brenda. Next up, Osase. Hopefully I didn't forget that from the last time. Osase was diagnosed with sickle cell disease when she was 3 years old. After having a life-threatening sickle cell crisis in 2020, she decided to undergo the bone marrow transplant. Osase is currently 7 months post-transplant and is the founder and CEO of Sickle Cell Warriors Collective Core, a digital company that unifies warrior voices through storytelling. As a sickle cell advocate, Osase sits on the advisory board with the Rare Blood and Bleeding Disorder Clinic in Calgary, Alberta. She's a member of the Sickle Cell Advocate Board of Calgary. Her goal as a warrior and advocate is to eradicate discrimination in the healthcare system against sickle cell warriors. I'm turning the mic over to Osase for her opening remarks, including touching on the core needs of the community at this moment in history. The mic is yours.
Hello, everybody. Can you guys hear me? I'm just in my car as
Yes,
well.
loud and clear.
Okay. Okay, perfect. Thank you so much once again for having me. And Elizabeth, you're getting so much better. Each time you pronounce my name, it's getting better.
Good. I need all the help I can get. I love the name, by the way. It's beautiful.
Thank you. Thank you. And I would say that one of the core values right now and core needs, I will always go back to education. Like, we need to infiltrate the education system, only because I'm also a nurse and I know what it looks like when something is really drilled down to you when you're in the healthcare system and when you're learning about certain diseases. So infiltrating the healthcare system will decrease the amount of people going to the ER saying that, that their care, their pain is being underrated, and they feel scared to even go to the ER because they look ridiculous asking for so much narcotics when they really need it. And starting Sickle Cell Warriors Collective, that is a common ground I've seen with all the patients I've connected with all over the world, even in the States, here in Canada, in Tanzania, like everywhere. That is a core common ground where it's like, we don't want the healthcare workers. They're always looking at us like we're crazy and that we don't know what we're saying. So I think infiltrating the healthcare system is very, very important, so that sickle cell warriors can feel heard, and when they actually go to the healthcare system, which is meant to help them and not tear them down, they will find that help within that the healthcare system. So that is what I think is the core values. Thank you so much.
Thanks so much. Next up, Monica Rockwell. Monica is a patient and patient advocate living with sickle cell disease and congestive heart failure. She is the founder of SWGA, Sickle Cell Awareness, whose mission is to make sure adult patients have access to medical resources. SWGA, Sickle Cell Awareness, YouTube channel is where she documents her journey and shares resources globally. I'm turning the mic over to Monica for her opening remarks, including touching on the key needs of the community at this moment in time. Monica, the mic is yours.
Hello, can everyone hear me?
Yes.
Okay. What I wanted to say is healthcare and health equity is great, but the key thing with sickle cell patients, which is one of the things that they don't talk about often, is the complications of sickle cell. What a lot of people don't know, that's patients as well as the medical community, most sickle cell patients don't die from the disease itself. They die from the complications of it, because most sickle cell patients have sickle cell and something else. For example, I have sickle cell and congestive heart failure. Some people have sickle cell and diabetes, sickle cell and heart disease, sickle cell and acute chest syndrome. And I could go on and on and on, but with health equity, that's why it's so important for us to continue to raise awareness about sickle cell, and always add that entity of what are the complications that come with having sickle cell. And I turn it back over to you.
Thank you so much, Monica. Really important perspective, and something that actually definitely needs to be aired out more. Next up, I want to introduce Donna Sullivan. Donna is a rare disease mom, patient advocate, writer, producer, and health activist. She's spent the last 10 years supporting children and families living with rare disease and complex pain conditions. She serves as the board member for the Coalition Against Pediatric Pain, as the director of patient advocacy at Pathways to Trust. She works tirelessly to elevate the patient voice and raise awareness of the unmet needs of vulnerable medical populations who experience higher hurdles to care. She hosts educational forums for patients and medical students that focuses on trust and communication to enable better health outcomes. And her work is focused on raising awareness of rare disease, patient challenges, healing medical PTSD, and reducing stress and trauma for both physicians and patients. I'm turning the mic over to Donna for her opening remarks, including touching on what she perceives are the core needs of the sickle cell community at this moment in time. Donna, the mic is yours. Donna, there you go.
Oh, Hi, sorry, is that better? Okay, great.
Yes.
Thank you so much for having me. I'm really excited to be part of this conversation tonight. I am coming at it from a slightly different angle as a complex pain advocate first for the first 10 years. And I actually became involved in sickle cell when my own daughter, who was a pediatric palliative patient, had a roommate, a young girl, who had sickle cell. And over 3 admissions, we were put in the same room with the same physician, and I learned a lot about the disease and the comorbids, which I think are a really important part of the education needs around sickle cell. But I also saw, as the girls transitioned to adult care, the difficult time that we had, and I compared it to the difficult time that she had as a young black girl presenting in the emergency rooms, and I just became enraged and dove in, which tends to be my nature. So now that I'm the director of patient advocacy at Pathways to Trust, it's been a tremendous organization to work with. We have a very successful campaign that Manisha is going to speak a little bit about when we turn it over to her. But we did a campaign called It's Time to Listen to Sickle Cell. And what we do is we go into medical schools and we educate healthcare providers about the surprising challenges that patients face. And we talk about the really uncomfortable topics. We talk about profiling. We talk about unconscious bias. We talk about misogyny, racism, and just try to open their eyes to not prejudge patients who come to them for help. So that's what we do with Pathways to Trust. We have this youth group, we have a sickle cell campaign, and we also work with patients, and we try to help patients understand kind of some of the challenges that they might be coming up against and why the system works the way it does to make it so hard to access care. And once again, we try to give communication strategies and promote understanding to try to rebuild trust, because as we know, you can really get your butt handed to you in the trenches of medicine if you don't get good care and you're not plugged in with a supportive medical team. So that's it. I'm Donna Sullivan. I'm happy to be here, and thank you.
Thank you so much, Donna. And I just want to
Actually, can
go
I add
ahead.
one more thing? I'm so sorry.
Of
You asked
course.
me a question, what I think is most important. I do agree with the previous speaker. I think there is definitely not enough understanding of how sickle cell contributes to other conditions that people live with that are comorbid. I also have a particular interest in pediatric pain and the transition to adult care. So that's my thought. Thank you.
Thank you so much, Donna. Appreciate that. And just for those that are watching at the top, Spencer is adding the organization. So the Pathways to Trust is there. And I know as we go through all the organizations from the folks that are speaking, we'll make sure are in the chat as well for those that may have missed the others or just joining us. Next up, Shantana Kruper is our next guest. She's a registered nurse who specializes in emergency medicine. She has worked in the ER for a little over 4 years and has a 5-year-old son who has sickle cell disease. She comes from a family of sicklers and has the trait herself. Unfortunately, she's witnessed the healthcare disparity of sickle cell patients from a medical standpoint and from the position of a mom. Her goal is to educate those who she works with, help treat sickle cell disease, and find ways to make a positive difference. Shantana, thank you for being with us. I'd like to turn the mic over to you for your opening remarks, including what you think are the core issues at this moment. The mic is yours.
Hi, thank you for having me. It's nice to meet you all. My name is Shantana. Like I said, I've been in the ER as a nurse, so I've seen sickle cell patients, and I've also had to visit, as a mom of a patient, the hospital systems with a son with sickle cell. And I feel like the greatest disparity right now is that there aren't enough close access to healthcare facilities that are able to treat patients with sickle cell. Me personally, for my son's appointment, it's an hour drive just to take him to a sickle cell appointment that may last 30 minutes at the most. And with it being like only one major hospital in the area that treats a patient with sickle cell, if you're someone who don't have close access, your only option is your local emergency room, where the doctors and nurses aren't really trained to treat you as you should, so you don't get the information, you don't understand your labs, you don't understand exactly what's going on, except, oh, I have pain, I come here, I get pain medicine. And it's a poor job being done at educating patients. And so I personally love to educate my patients. I love to print off their labs and send them home with their labs, and so they can start a trend, so they can actually know what we look for, how we recognize that they're in a crisis, and just provide them with information that they could also pass down and share with someone else. Um, I don't have anything else to say at the moment, but I appreciate you for inviting me into this discussion, and I am looking forward to hearing from the rest of the panelists.
Thank you so much, Shantana. Appreciate you being with us and providing that perspective. Next up is Renisha Edwards-Elliott. Renisha is the current program coordinator for the University of Illinois at Chicago, Sickle Cell Readiness and Transition STAR Clinic group care program. Through her role, she offers a diverse patient experience, medical social work, case management for patients, and expertise in developing relatable and understandable patients' educational materials. Renisha focuses her work on bridging the gap between healthcare, mental health, and empowering patients to pursue suitable workforce and/or post-secondary opportunities despite disability limitations. As a sickle cell patient, Renisha has dedicated her professional life to micro and macro level advocacy for sickle cell patients. Her patient experience and connection to the sickle cell community enables her to provide qualified patient input and experience. And as an advocate, Renisha has helped create American Society of Hematology sickle cell guidelines concerning pain management for healthcare providers. Presently, she's completing a doctoral program in health sciences where her research focuses on incorporating patients into interdisciplinary care teams. I'm turning the mic to Renisha for her opening remarks, including touching on what she sees as the core needs of the community at this moment in history. Renisha, the mic is yours.
Good evening, everyone. Can you hear me?
Yes, we can hear you.
Thank
We have
you.
there's
Thank
a
you so
little bit
much.
of static. I don't know if you're able to get a little closer to the mic, but we can hear you.
Okay. Is it a little better?
Yes, that's better.
Okay. Thank you so much for having me this evening. I'm so happy to represent sickle cell disease as well as Pathways to Trust. So what I I specialize in mental health, quality of life, as well as research concerning sickle cell disease as a patient living with this disease. And what I would say, first of all, the importance of, as many of the fellow panelists have said, education. However, I want to take it one step further and say, in order to address health equity in education, we must first be willing in our healthcare system to address implicit bias and to understand stigma reduction. And so I'm so honored to be able to produce and help with trainings of medical professionals so that they can take a good look at themselves and understand that the care that they deliver to people who are living with this condition, as well as to understand that the first thing to fight to make sickle cell disease more equitable is to understand that medical professionals are experts in science, while patients are experts in experience. And so I would say the first thing that's important is to elevate the patient voice and to understand that hearing patients is what is most needed, to understand that we will never make it and approve sickle cell disease health management without listening to the experiences of patients. With that, I would also say that we need to understand the social determinants of health. We need to understand the whole patient. I can tell you countless times where my health was considered, but other conditions of my living circumstances, my interpersonal relationships, my inability to hold stable employment was not addressed. And if we want to make sickle cell disease more equitable, we have to be able, as a health system, to address the whole person, the whole patient, in order to change that. So I'm looking forward to being a part of this conversation. please feel free to reach out to me if you are interested in trainings. We do have a couple scheduled, but more importantly, I think that this is the first step to making sickle cell disease popular, to make it known, to pave the way for voices to be heard of people who live with this disease, who are advocating on a daily basis for it.
Thank you so much. Appreciate your perspective and appreciate all the important work. I want to next up introduce Kevin Wake. Kevin grew up on his family dairy farm in Leavenworth, Kansas. Although he and his two brothers all have lived with the diagnosis of sickle cell disease, Kevin's parents always instilled in him that having sickle cell disease did not define what he could achieve. He has a BA in human biology from the University of Kansas, an MS in healthcare informatics from Walden University, and a community health worker certification from Sickle Cell Disease Association of America. For 23 years, Kevin worked in the pharmaceutical industry before retiring in 2016 due to health complications. Kevin is currently the president of the Uriel E. Owen Sickle Cell Disease Association of the Midwest, a community-based organization in Kansas City, Kansas. Some additional involvement of his includes advocacy through the Rare Disease Legislative Advocates, chairman of the university's Health Patient Family Advisory Board and Council, a member of American Society of Hematology, Sickle Cell Work Group, Centrix Technology Patient Family Advisory Committee member, and he's worked on the National Health Council's Value Initiative Work Group. Kevin, really glad to have you with us. I'm turning the mic over to you for your opening remarks, including what you perceive are the core needs of this community at this time. The mic is yours.
Good evening, everyone. I'm very happy to be a part of this discussion tonight. I think these discussions are extremely valuable. When I think about the core needs of the community, that is a very complex question, and I think everyone has really touched on so many different aspects that are needed within the community. I would say the education awareness piece is a huge umbrella that encompasses so much. Increasing awareness and education with patients can help patients really empower themselves to receive better care. It will also help them develop trust within the healthcare system and also inspire them to live beyond their diagnosis. I see education and awareness needed with providers, both current as well as future providers, so that they better understand the disease and also engage with the patients better, but ultimately use regular standards of care when treating sickle cell patients. And then finally, I think education and awareness is desperately needed with industry partners. We are at a point here in the States with a lot of promising developing treatments as well as therapies, and those are on the horizon. The community has to be ready for those, and the only way that we're going to be ready is for them to be able to better understand those therapies before they come to market. So again, awareness and education is a huge umbrella that I think is probably one of the biggest core needs within our community. And again, I'm very thankful to be here and be a part of this discussion.
Thank you so much, Kevin. Appreciate your perspective and look forward to diving into the conversation. I next want to introduce our last but not least, Maya Bloomberg. Maya is a board certified family nurse practitioner at Sylvester Comprehensive Cancer Center at Jackson Memorial Hospital. She's earned both her bachelor's and master's of science in nursing from the University of Miami. She's worked as a hematology nurse practitioner for over 7 years, specializing in sickle cell and bleeding disorders, which shed light on the significant health and racial disparities that exist in modern medicine. This led her to create a social media page called @thehemamp. And Spencer will post it to the top here shortly so that you can see that, devoted to providing reliable information to sickle cell patients so they can better advocate for their health, with the hopes of bridging this disparity. Maya, I am turning the mic over to you for your opening remarks, including what you perceive are the core needs in the community at this time. The mic's yours.
Hi, everyone. Thank you so much for including me and being part of this conversation. It's so needed. And I think at the end of the day, when it comes to sickle cell, there just lacks awareness and full understanding of the condition. And because of it, there's so much stigmatization and mistreatment associated. There's so many issues. I don't even know where to pinpoint and where to start, but I think a lot of it is just the framework of the healthcare system. And there's just a lot of providers who have their own implicit biases that ultimately will impact the type of care and treatment that patients are receiving. So I'm always so inspired by all of these sickle cell warriors who are going into the medical field to try and change that. And I feel like the new wave of doctors and new generation is going to be what it needs to really take it up a notch and bring more health equity. But in the meantime, we have to just continue to spread awareness and understanding so people realize there's more to sickle cell than just pain and anemia. It's a condition that really is characterized by premature mortality. You can just have one crisis that really changes everything. And I feel like if more people understood the seriousness of it, they would take patients' complaints much more seriously.
Thank you so much. Appreciate your perspective. Okay, so as we have, sort of set the table, we know who's who here. I just want to invite everybody who is here now and also in the audience. We do want this to be participatory. Feel free to raise your digital hand. Feel free to add content to the chat so that we can maximize the utility of this room. I want to just sort of step back and ask, broader questions related to a number of things that have come up before, and I'm just going to air them out just so that I put the food on the table. And I should probably also mention, and Spencer, I'm sorry for all this back and forth. So Maya's information is at the top for those that want to take a look at that. We are holding a virtual whiteboard where we're endeavoring to capture the ideas, the themes in a virtual white space, and it's open to participation. Ultimately, this will be a body of work that will live in between each meeting and ultimately help us as we think through how we can curate these discussions and make sure we're capturing all the issues. I do want to give a nod to, I know one of the things that came up the last time is, hey, where is the state of research? We hope to have a PhD, MD who's at Stanford studying and working on some really interesting stem cell research, which will be interesting for this community. So know that we're hoping to have him next time. There are a few other areas where I know we've identified, for example, employment law, which we heard spoken earlier just as one of the issues that's, part of the challenge of living with any sort of disability, but particularly this disability. And then, all the other aspects of, diagnoses, treatment, pain management, prevention, screening, research, education, all these themes that have popped up over and over again, including the different kinds of education, whether that's the public, the doctors, the care teams, the nurse, sort of the ecosystem. So just want to pepper the conversation to say that this conversation sort of travels in time with us as we are evolving and as we're gathering more people. That said, I really want to dig into what systemic needs folks perceive. Obviously we've touched on some of these, but if we were to say, if you could wave your magic wand and say, okay, here is the first thing that needs to be done to transform this health equity issue. And I know it's multifactorial, so it's probably too hard of a question. So feel free to add more than one if you feel like that. But I'd like to just ask folks. We'll go around the room here, and I do see. I think we just got Sandra, also somebody from the audience. So Sandra, we see you. We'll come back and get your question in or comment and invite you to add to the conversation as well. So hang in there with us, and we'll be with you as we go around the room here. Monica, can I turn the mic to you first to get your thoughts? Okay, I know you guys are probably looking for your mute button. Monica, going once, going twice. Okay, I'll come back to you. And I'm just going in the order I'm seeing you guys right now on the screen as I refreshed. Ranish, oh, Monica, great, you're back. Yeah,
I
so
was trying to find the
I know,
button.
it's, we've all been there. So yeah, just your thoughts on this most systemic issues, the core issues that you perceive. I'll turn the mic over to you.
Well, it goes back to what has been said. I think there's a lack of education and a lack of misunderstanding, especially in the medical field, in the healthcare field, and also families. There's a lot of information that families don't know about sickle cell. When I was first diagnosed at 38, there was a lot of things that my family did not know about sickle cell. And when I was diagnosed, there was no information from my medical team. The medical team that I have now talks about it more than the original team. But I do think a lot of it is sometimes people just don't know what they don't know. I think that's the biggest thing. And then there's one sentence in the medical books about sickle cell. There's not enough information out there for medical professionals as well as families to have access to information, good information, credible information. So that's where all of the misunderstandings and the mishaps happen often. That's what I think. That's what all of this I don't know why I can't talk now. That's where all of the issues come in at a lack of education, a lack of communication with medical professionals as well as with patients and the patients' families.
Monica, thanks so much. And I'm going to ask the panelists to come off mute. Those that want to reply to this, we'll kind of popcorn style. So whoever wants to reply to that, and then we'll take your thoughts to build on, and we'll kind of move around that way, if that's all right with folks. So I'm looking. Oh, Renisha, I see you came up.
Elizabeth, can you ask your question again?
Oh, sure. Yeah, just thinking about all the issues that have been raised. If we think about the systemic, kind of core, and it can be the same as if education is ultimately the systemic, that's where we are. I just wanted to ask the kind of what's first. There's a lot to do. If you had to say this is where I would put the most energy and the emphasis, what would that be? And feel free to answer a different question if that's not the question you want to espouse on. So Renisha, feel free to do that.
Yeah, no, I would love to chime in. So Monica eloquently said about education. And so I do think that's a systemic issue, but further along with education, I think that we need to take a step back as the health system to look at medical providers in sickle cell disease. I often share on my patient journey that sickle cell disease, I didn't ask for this disease. I was born with it. And unfortunately, it's not something that, all of us will be able to be cured from. As well as I believe one of the panelists said about the many complications that are associated and complexities of having the disease. And so I think that we have to do a better job of really helping medical providers understand that to work with sickle cell patients is to really understand the disease, is to have healthcare compassion, and to want to work with this population, to want to help this population. This isn't a population you show up for every day for just a paycheck or just to to make a means to an end. This is a population that deserves qualified healthcare professionals that really care for them and really understand the complexities of the disease. And when we take a step back and understand the many multi-dimensional layers of this disease, we'll stop having such unrealistic expectations of patients. When we understand what it feels like to be in the worst pain of your life, we'll stop expecting people to dress up their disease to come into ED departments to receive inadequate pain medication or to have to plead and beg and to look a certain way to get what they need to feel better. When we understand sickle cell disease, we'll stop labeling people who depend on opioid management as drug seeking, understanding that most times that IV medication is just a little, not really even taking the edge off if you really understood what sickle cell pain feels like. And so education is not just educating people. I really have pushed back a lot when it comes to education, because I really don't think that we can educate on racism and stigma. Sickle cell disease is something that is structural racism, similar to what we're seeing in many other parts of our systems within America and many other countries. That disease that affects minorities, that diseases that affect people of color, they're just greater disparities associated with it.
If I can piggyback a little from what Ronisha said, and Monica too, I think education is a huge thing. I think there needs to be compassion. I think there's everything that we're saying is so accurate, but when I'm trying to think of what are some actionable items we can do to really change the care and the treatments and just the health outcomes for people with sickle cell, education, it really is a huge piece. Obviously, you can't teach somebody to be compassionate. I mean, just when it comes to sickle cell pain and the attitudes and care towards it, I think it's just unfathomable. People really can't understand the type of pain sickle cell truly causes. I mean, I deal with back pain, and my first back flare up, I couldn't walk. My husband had to carry me room from room for 2 days. And I feel like that experience gave me a little insight of what sickle cell is, but mine went away. It's not a lifelong thing that causes other types of complications. But there's just a lot of lack of education among primary care physicians. I mean, there was a big study showing the different impact sickle cell has across all boards. And one statistic that came out was only 20% of primary care providers feel comfortable treating sickle cell disease. And if you think about the role of a primary care provider, they're the ones who really have the most patient contact. And a good primary care provider very well can start a sickle cell patient on hydroxyurea, teach them about certain things. And the study confirmed that these PCPs aren't even aware that guidelines exist for the management of sickle cell. So I think there's a lot of educating that we can do beyond just the specialists, because it's known that there is a national shortage of specialists who can provide care for sickle cell patients. But when you think on a larger scale, well, you can't just get specialists, because unfortunately some providers, they follow the dollar signs rather than their heart. So when you're going for money, unfortunately, hematology definitely is not a specialty that brings in the big bucks when you compare it to oncology, for example. So I think we need to focus beyond the specialists and really highlight the education piece that needs to happen on a primary care and a family practice level, because I think that is an area where we can really improve health outcomes for these patients. Because if you have your direct contact and you have somebody who's competent and knows more than sickle cell is just a disorder that causes pain and anemia and primarily affects people of color, you can provide such better care, which will have to translate to better health outcomes.
So, Maya, did you have anything else you wanted to add? And then maybe whoever wants to come off mute next and weigh in on what they think the systemic lever is to push. Did I see Shantana? Did you come off? I'm going to pass the mic. First of all, let me see. Maya, did you have something else you wanted to throw into the systemic pool, and then we'll pass it to Shantana?
Sure. The other thing, I'm just thinking about things that I'm trying to work on with our system and within Florida that I feel like on a larger scale could make a difference is I'm trying to work with Medicaid insurance and other insurance companies on their policies for pain medication, because when it comes to the opioid crisis, they put a lot of restrictions for getting narcotics for patients. For cancer patients, no problem. But when you look at sickle cell, this opioid crisis and the restrictions are making it more and more challenging for my patients to get their medicines, where I'm now having to have them sign pain contracts and do urine drug tests just to check off a policy box for for the insurance company to authorize it. So I think reviewing the policies and realizing that sickle cell quality of life and health related quality of life really is similar, if not worse, based on some studies compared to cancer. Yet when it comes to access to treatment and when it comes to sickle cell crises, I mean, you need your narcotics to treat these and to avoid hospitalizations and ER visits, but they don't allow easy access, because I can't tell you how many times a week I'm fighting an appeal for a denial for a pain medication because I didn't have a drug test in 30 days or the most random reasons. But that's just one thing that is just going to ultimately land a patient in the hospital. And with each hospitalization, you're exposing yourself for other risks. So I think those are my main action items that I feel like are achievable in the short time period.
Thank you, Maya. Shantana, and then I think I saw you FOMA next. So Shantana, the mic is yours.
Hi. I just wanted to say while I was in nursing school doing my clinicals, I never actually wanted to go into the ER. That wasn't my I wanted to be a L&D nurse, but while I was doing my clinicals in the ER and nursing school, I had the nurses were saying, "Oh gosh, it's about to be Sickle Cell Saturday." And I got excited because I might had a baby at the time who had sickle cell. And so I was like, oh, what's Sickle Cell Saturday? I thought it was a special program or something that they offer for sickle cell patients. And they said, oh, that's when all the sicklers come in seeking drugs. And then at that moment, my heart broke. And I was embarrassed that I was it was a weird feeling. Like I was like, I couldn't, like, scared to say that my son has this. It's like, is this like how they going to look at? So many things came over my head and my emotions that I didn't know how to figure it out at the time, because I personally didn't have to deal with the stigmas of sickle cell. My dad had it, but he sheltered us from the bad stuff about it. And so I'm like, this is what people think. It's like an eye opener. Most people don't realize this is how your healthcare providers look at you or think of you. And I think that night I said, well, I'm going to be an ER nurse and I'm going to change that. That's not what Sickle Cell Saturday shouldn't be, how it's looked at as, oh, this is the time where all these patients come seeking drugs. And so it's kind of I don't know, it's kind of a indifferent situation, because once you're in the healthcare system and you're part of the team and people find out that, oh, you're a parent of a child with sickle cell, they treat you different, but only you, because they know you. But it doesn't go across the board to other families or other patients. It's kind of like, oh, well, we know her, so let's treat her kid with more respect. Like, all sickle cell patients are considered a level 2 patient, but they don't get treated as a level 2 patient. Level 2 is how the ESI, how we can see who goes back first. Level 1, you're not breathing unresponsive. Level 2, emergent, needs to go back next. And sickle cell patients are considered level 2 because of the complications, like the previous panelist said about acute chest syndrome and the different complications of having sickle cell that could actually kill a patient. But they'll leave patients sitting out on the board or put a sickle cell patient as a level 4, meaning that it's non-emergent. They don't have to come back. But that's not how you actually supposed to treat patients. And it's kind of crazy because it's like, I feel like it's a fail in the education system in school. And I only learned about that doing my own research on sickle cell for my BSN, that all these patients are supposed to be considered level 2 at all times and supposed to come back immediately. But it's like, it's something that's overlooked, and people are taught by other people ways, not technically by how it's supposed to be in the books. So I just wanted to put my input on something that I personally experienced, and it's basically the stigmas that I feel like are hurting people from learning. They got to unlearn stigmas.
Shantana, thank you for raising that. And yes, very heartbreaking to hear. Ufoma, I think I saw you come off, but I do want to just make sure, Shantana, if there's anything else systemic that you want to put on the table here for the chat, want to give you a last chance to do that, and then we'll go to Ufoma next.
No, that's all. Thank you, guys.
Okay, great. I just wanted to make sure. Ufoma, did I see you come off mute? Was that, yep, that's you?
Yeah, thank you
Okay,
so
the
much.
mic is yours.
Thank you, Shantana. That was a really, really powerful story. I think that's gonna stick with me for a really long time, just like, Sickle Cell Saturdays. yeah, that's really heartbreaking. So, but thank you so much for sharing that, and just kind of following off of that point, and just like what other people have said thus far, and especially in regards to sickle cell patients being labeled as narcotic seeking. I think a big thing, like systemically, that needs to be addressed and rectified. And although it seems like such a mountain to climb, I think little steps can slowly get us to a better place. Is EDI training, so equity, inclusion, and diversity. And I know sometimes it feels like, education, 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 but sometimes people just need to be enlightened. And I think at the end of the day, like the systemic issue is the fact that the system, there's systemic racism that we have to deal with, being sickle cell patients and parents of sickle cell patients and whatnot. And so when the system is biased and has prejudice towards us due to our skin, it really does, like, although our disease is invisible, our color is not. And unfortunately, we have to face the consequences of that. And so I think that if there's access and we're able to give like healthcare providers access to resources, and not even access, but it should be included in all training. Just more things about equity, inclusion, and diversity, as well as also just having more diverse individuals who are on healthcare teams, providing more resources for there to be more Black doctors, nurses, and other individuals involved in the healthcare system. I think that would really help, just because, like, unfortunately, the way I see it as is I think it was Shantana that had mentioned, like, when it's a cancer patient and they need narcotics, there's no problem. And um, not that cancer necessarily has like a color or anything is associated with a particular color, but because sickle cell is predominantly associated with Black people, when we are looking for medication, we're also Black, and so they're probably looking at us like, oh, like, it sounds as vulgar as it sounds, but if they're using the term sickle cell Saturdays, it's really just saying, oh, this is when the Black folk are coming in to get their drugs. And like, that's really, really disheartening. And I think that more education needs to be done in terms of like making healthcare providers channel their biases, their implicit biases, and moving away from that. As I wrap up my undergrad, I also did a program in leadership, and that was a lot of the work that we did, was looking at our biases, and like also like looking at in terms of how to respect people's dignity, irrespective of whatever background they come from or whatever they look like. I also did a bunch of stuff in women and gender studies over my degree, and I think even just learning about, like, here in Canada, there's a lot of issues with how the government and the system just treats Indigenous folks, and unfortunately, they're going through a lot. It's really, really sad. And whilst taking all these women and gender study classes, I was really enlightened to a lot of things that you just don't know. Sometimes as it's human nature to make a lot of assumptions and have biases. Like, we can't control our biases sometimes. But I think when the education is there and you're now enlightened, you're able to see, like, you're going to have a second thought when you want to go and assume, oh, that's just how they are. They just want drugs. That's just how people of color, Black people are. You know what I mean? So I really, really think that addressing the racial bias within the healthcare system and providing them with equity, inclusion, and diversity training, and just more education on that, as well as having diverse staff, is the way to go. But I've got a meeting now, so I really have to go. This was a really great conversation. I'm always privileged to be here. So thank you guys so much.
Thanks, Ufoma. I appreciate the perspective. And here we think Canada's got a better system, but it just goes to show you that it's a pervasive problem all over. Kevin, I saw you come off mute. I'm going to turn the mic over to you.
Yeah, I just wanted to follow up on, some points that Foma actually just talked about. You know, and I think Renisha also touched on this too, and that is really the power of the patient voice. I think we all, as sickle cell warriors, have had experiences of going to the ER and being treated as a drug-seeking patient. But just a patient of color, that brings in a whole nother dynamic as well. I was living in Chicago when I had my first stroke, and my stroke left me with no balance and not able to speak. So I was not not communicating with the EMT. And I know my case when it was called into the hospital was a black male in his 30s that was either experiencing a drug overdose or intoxication. And that was how I was triaged at the hospital. So, automatically they looked at me as a black male, and that was the conclusion they jumped to. Um, and, one thing that I've done a lot here in Kansas City with our community is really try to.
Kevin, can everybody? Oh, there you
Okay,
go.
sorry. Um,
That's okay.
but yeah, I think it's so important that um, we need to educate like medical providers to look at patients beyond skin color or their symptoms of needing pain medication. And, one thing I do a lot with our medical students here is really try to bring in patients to show them the face of sickle cell outside of a crisis. And I think that is so important that we really showed them that we are not just someone that's in pain. We're not the troublesome patient that they see in the ER. We are so much more. And hopefully that will help patients and get better care, but also help providers kind of overcome their independent biases and stigmas to really see patients as patients and not patients of color or patients that are drug seeking. So again, Foma and Renisha both, I think, made some really good points that I think is crucial with our education with our current providers.
Thanks so much, Kevin. Donna, I want to turn the mic over to you. I see you've come off mute.
Thank you so much. I think this is such an important discussion, and I just have kind of two quick points that I wanted to add. I think about the times when you go into the emergency room, and you really get a double whammy here because you have, racism and you also have bias against pain patients. So when you put the two together and you show up in an emergency room, I think one of the systemic issues to look at is what is considered an acceptable standard of care, especially when it comes to a patient that's in acute crisis. So, when they whip out the smiley faces and say, rate your pain 1 through 10, and that, that scale doesn't really apply given the level of pain that you experience, regularly. I think these are the kinds of things that we could look at more systemically. What are the standards of care that need to be challenged? What are the follow-up needs, especially someone who mentioned the primary care? I think that's a highly underserved role in someone's care team. So the second point I wanted to make is that somebody had said that you can't really teach compassion. And I think, to a certain degree, they may be right, but you can communicate and try to foster it, and try to foster empathy. And, I think, when we do some of these pathways trainings, we go in and do emergency room training with emergency room, and we bring patients in to talk about what does it feel like to come into the emergency room. I mean, let's be honest, that's the last place anybody wants to go. So, what did it take to get you to go and subject yourself to the indignity of what it means to be a sickle cell patient in crisis? And the responses that we get, generally are tremendously moving, and it definitely helps to educate, healthcare providers a little bit more about what Renisha was saying, the whole patient experience. And I think part of elevating the patient voice has to be explaining the whole experience. And sometimes that's as simple as what it took to get you into that doctor in the first place. So I'm Donna, and I'm done speaking.
Thank you so much, Donna. Such an important part of, and I think the thing that comes to mind, it's not nearly the same, but it's really just figuring out a pain framework that others have, at least some cognitive access to, whether it's kidney stones, which I know are different, right? But still, where there's just more prevalence and therefore more capacity to understand that this is not, it's not something you can just, get over. I can only imagine, I'm just going to, put it out there that I know the indignity of the the pain seeking, I personally live with a very substantial um, regular occurrence of kidney stones. And so I know what it takes to, I've frankly tried to never go to the hospital for anything, right? To have everything I need. But the opioid crisis has made it so much more difficult to care for yourself at home in today's world. And then if you get out of the cycle, which is different, but if I get out of the cycle and I can't take any oral meds because, I'm throwing them up because I'm in so much pain, then there's no choice but to go to the ER. So, and I know how undignified that experience is as a white woman, and I do not pretend to have any. I just know how horrifying it is to be in that place myself, and so I just really want to, extend compassion and my own sense of empathy for the double whammy, which is racism coupled with pain seeking. Because trust me, I get the pain seeking, and I'm like, look at my medical file. I have this condition. You've got documented evidence on CT scans. Anyway, not the same, but I just, sharing openly here. Kevin, I see you're off mute. I don't know if you wanted to jump in on Donna's. Okay, I
Yeah,
see
I'm sorry
you're.
about that.
No, it's fine. If you and I want to give others on the panel an opportunity to speak to the systemic issues. And I see Sandra is here. I want to give her an opportunity as well to participate. I'm going to see if any of the panelists want to flash their mic at me if you want to jump into the systemic conversation. Oh, Brenda and Lupe. Brenda, go for it. And then Lupe, and then Sandra, I promise we're coming to you. Brenda, the mic's yours.
Thank you, Elizabeth. I know you mentioned earlier about if we had a magic wand, and my magic wand, I'm like, I hope it's super big, because just listening to the conversation, and as I mentioned in my opening statement, our nonprofit pushes for awareness, and everyone was talking about the education piece, and I honestly believe that the education piece can lead to so many other things, from uh, more, whether it's education of physicians and healthcare providers and the warriors, of the caregivers. It can lead to more funding, more that can lead to better access of care. Um, it could actually lead to systemic changes where that education piece can actually allow for, I know locally, a culture change somewhat at the hospital systems, especially when I think it was Ronisha was speaking on the power of the patient voice. And and I know that Shantana shared her story, and that really touched me as a caregiver, because we were in a, you know, with our son who has sickle cell disease, even at the age of 9, my husband and I, before we went to an ER visit that had to be necessary and we had no other alternative. There were things that we would do before we would go to an ER, and we would go together. I would make sure I'm presentable just to avoid any unnecessary stigmas or biases, just to get him care. And we've had an unfortunate interaction in which we were accused of bringing our son to the ER just at 9 just to get pain meds, and which it in turn turned into a 7-day ICU stay, a PICU stay for him, because he had acute chest syndrome, and we almost lost him. But that in itself, things changed systemically at our hospital system, because by that point, I was already in advocacy, already figuring out how to navigate the system and recognizing some things. And so I knew who to talk to. And so therefore, I made sure, I wanted to have a seat on that advisory council, to just within the hospital system find out what the protocol should have been, what shouldn't have happened. Um, and to make a change systematically within that hospital system. And that's just a small way of doing it locally. But education definitely is that piece or that key, I think, that can basically change a lot of things. And I know I was rambling, but this has been a very good conversation. I'm glad to be a part of it.
You weren't rambling at all, Brenda. I think very coherent. Lupe, I think I saw you flash your mic. I want to give you an opportunity, and then we're going to go to Sandra. Lupe, going once.
I didn't flash my mic. I don't have anything on
Oh,
at the
okay.
moment.
Sorry. Maybe
It's okay.
it just maybe when I was refreshing, it just looked like that on my screen. Sandra, I'd love to give the mic to you for whatever comments or contribution to the conversation you'd like to make. The mic is yours.
Yes, thank you. And thank you so much to everyone for having me come up to the stage. I certainly appreciate it. As I sit here listening to the conversation of what's going on and how the sickle cell warriors that are on stage are sharing their stories and sharing what they have went through, I just want you to know that I stand here with you. I stand here side by side with you. I've fought that fight, not with sickle cell, but I have two other chronic conditions that I've fought that fight for. As a board certified patient advocate, I empower all patients, not just some, but all patients to use their voice, because their voice is the most powerful tool they have when they seek medical care. And when they don't use it, they just don't get treated the way that they're supposed to be treated. And it's unfortunate that it happens. So as I suffer with you, one of the conditions that I have is neuropathy, and I can only imagine the pain you go through if what I go through when I have neuropathic sprouts and neuropathic pain. I can only imagine. So I stand here with you. But I did really quickly talk about, I heard earlier two different things that I just really wanted to briefly touch on. One of them was the 7-week, the 7-week time period when it comes to, how much time you can take off. I'm not sure who's listening, who's in the room. Please, if you have an employer, if you're working for an employer, please ask them about their FMLA, their FMLA time, how you go about getting it, what's available to you, because that for me has been a lifesaver. I do still get to 7 weeks, but there have been times when I've actually had to use more than 7 weeks, and more than time that's allotted. And I've been able to use that time because I have the FMLA. I happen to work for a very good company that pays me for the time that I take off of FMLA, but even so, please do ask and inquire about what that process is, so that if you need more than 7 weeks, you can take more than 7 weeks. That's the first thing. And then I also heard talk of the underlying condition issue. I've self-published a health journal for that very reason, right? We, even with COVID, people were passing from COVID that really were passing from underlying conditions that were passed down through the family, genetic, and no one knew about it, no one talked about it. Well, having a journal or having some place where you can write down information, not only about your personal information, but also about your family information, is so important, not only for you, but for your children, your grandchildren. For decades, they'll have that information that's so readily needed. I am going to go ahead and pass the mic back, but please, for all of you that are on the stage, know that I stand here with you, side by side, fighting that battle. While you're fighting sickle cell, I'm fighting some other things, but please be encouraged to keep speaking up, keep using your voice, and keep being empowered patients. Back to you, Elizabeth.
Thank you so much, Sandra. I appreciate your input here and participation. So we're at the point in our program where we want to ask the panel, what's next? As we think about curating our room for the next conversation, and some of these issues will emerge, over time. But as we think about, how do we make the impact we want to make? Who do we need to have in this conversation? How can we be most supportive, including, if we need to curate this differently. This is for you. I'd love to go around the room and hear from you. We know we're trying. Chris, thanks. I'm going to come to you first since I see you came off mute. I know we're definitely aiming to get some of the forward-looking, like what's on the horizon for research, cure, like what's next, right? So yes, let's adapt and try and get the system to be better, and kind of like where are we heading? That's another piece of the equation that we heard last time that is important. Policymakers, funders, so I know that we are inviting a number of grant makers to this forum, and I know some we might have some interlopers, and we'll have others that will be joining us next time. I know there's a big push on that front, but I just want to open it up for, what do we need to do between now and next time? Chris, I'm going to give you the mic first since I saw you come off mute.
Thank you, Elizabeth. I wanted to go back to what Sandra had to say, just to give a real life example about just being a patient and speaking up. This was probably about a year. I'll say probably a year ago at this point. I moved a lot with my job, but I moved to Columbus, Georgia, and so in Columbus they have a sickle cell. They have sickle cell doctors there, but the patient care isn't. They don't have a facility set up for sickle cell patients. So I was traveling. If anybody knows anything about Georgia, I was traveling from Columbus to Atlanta, Georgia, which is probably an hour and a half. And so the hospital I was going to, the apheresis person who was over me during my stay at the hospital wasn't the best. I'm kind of used to gentle care, being from Birmingham and going to UAB. That's pretty much what I've known. And being in Atlanta, the apheresis person who basically was taking care of me was kind of rough. And so I voiced it and told the doctors about it. And I even reached back out to my doctors and the social worker in Charlotte, which is where I had just came from. And I basically chose to drive 2.5 hours to Birmingham, which was the closest um, sickle cell hematologist doctor. I chose to drive there 2.5 hours, which is where I knew they would take care of me well, versus going to the hospital in Atlanta. And I think that was probably one of the best decisions I made when it came to me dealing with my sickle cell, because I feel like as patients, if we're in a stressed out situation during our procedures, and even if it's just any type of daily thing that we're doing, we can't function correctly. So when Sandra said, basically the power of the patients, that really stuck out to me, because I think, yeah, we have to really use our voices to get things changed. And I don't know if that person is still there, but I know when I told the social worker, she basically said, hey, this is what we're gonna do. So yeah, that's pretty much what I have.
Thanks so much, Chris. Okay, so let's do a lightning round and just curate the space for the next time in terms of what we'd like to see. Monica, can I start with you? I know you're finding your mute button.
Yes.
Yeah.
What I hope for and what I look for, ISCANAPA International Sickle Cell Nurses and Professional Associates, they've created a curriculum for nurses that has not been put out in the education system yet, but they're doing simulations this summer to see how it goes. I'm definitely looking forward to that and continuing to host educational events myself. I host 3 educational events a year to educate my community in the Southwest Georgia and beyond. definitely continue to educate and raise awareness going forward is what I hope for. Can anyone hear me?
Oh, Monica,
Now we
I
can.
can I can hear you now. Can you guys hear me?
Oh, wow.
Yeah.
Did I talk on
Yeah,
mute?
No, I think I heard you speak, Monica. Did others hear Monica?
Yeah.
I did.
Okay.
Okay,
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 good.
okay.
I heard her. I think the app went out once she was done or something.
Oh, okay. Yes, there's always some little glitch, but Monica, I think we heard you loud and clear. Um, Renisha, did you want to go next? Your sort of closing remarks and what we need to do to curate this for the next time?
I think first of all, this has been great. Really, really great to hear from other advocates. And I really hope that this recording reaches those who it need to be, because we all here, we understand, but there's people out there who don't. So with that being said, I would love for us to talk about the patient voice, to talk about professional advocacy, to really empower patients who have not yet found their voice to feel like they have a voice, to understand that at one point in time, we all probably have experienced a time where we felt silence, whether it was through the health system or through our illness, where it just silenced us. But it's power when we form community, and when we help one another, and when we embed patients into health systems to really bridge the gap for the medical community. So I would love to curate conversations about advocacy, helping patients feel empowered in their healthcare, to feel autonomous, to feel self-determined.
Beautiful. Thank you so much. Donna, I'd like to turn the mic to you. Same question.
Sure. I think this has been a tremendous room, and again, I want to thank you for letting me be part of it. I think some of the areas that I would love to explore in this room are also focused around patient voice and empowerment, particularly pediatrics when they're moving into adult care, and kind of the role of parents having to kind of step away and help your child learn how to advocate for themselves in the adult world. Secondly, maternal health. It's always hard to advocate sometimes when you're pregnant. Anyways, regardless of when you have some sickle cell and other complications. So I think the maternal health question is a really big one. And then I think another one to think about is, how do you advocate for yourself when things are going wrong? When you're in a hospitalization situation, sometimes patients don't always know what their options are, or what they can do to try to improve the experience and the level of care. So, I think that's another thing to think about is, what do you do when you're not getting the care you think you deserve? Um, those are my 3 cents. Thank you, everyone.
Thanks so much, Donna. Brenda, same question to you.
Thank you. I know you mentioned earlier about reaching out to other people. I think that's good to get the conversation expanded, especially, and I think Renisha mentioned the people who need to hear this message, and possibly invite policymakers, like you've said, reach out to them and have other people in the medical field that make decisions within their hospital systems. Just expand the panel and invite people so we can share and have a dialogue and begin to make some of those changes. So that's my recommendation. Thank you.
Thank you so much, Brenda. Osase, your thoughts?
Yes. Sorry, can everyone hear me?
Yes, we can.
Okay. Okay, perfect. This has been amazing. I was just, sitting back and hearing everybody speak. And I think that I'm with um, Renisha, I'm with Donna, I'm with Brenda on empowering the patients to know how to use their voice. And I remember when I was in college, I think it was first year, and I was going through so much that entire week with studying and having deadlines. But in the moment of going through that, I had a pain crisis. So I went to the hospital, the ER, and they gave me my narcotics to help with my pain. And I remember one of the ER nurses coming and saying, "Get up, you have to leave. You've gotten your dose already," because she saw me as a drug seeker. And so in my mind, one of the things that hydromorphone causes is confusion. So I was confused. I was like, oh, maybe she's right. She's a nurse, so she knows maybe it's time for me to leave. Never have I had an ER nurse tell me to leave. So when I left, I got into a car accident and I almost lost my life. And so fast forward to me telling my instructors this, they're like, "Oh my gosh, you should go tell somebody, you should report it," and this. And in my mind, I'm like, I have so much work to do. Report what? Where do I start from? Who do I speak to? And so I didn't even know where to go. In my mind, I was like, it's okay, it's fine. Like, I almost got into a car accident, and I'm saying it's okay for an ER nurse to have kicked me out, right? And so when I actually went back to the hospital, they protected their own, which I know the healthcare system does that. So sort of teaching patients, okay, when you go into the hospital room, you have a binder, you have a book, you write things down. After that day, I never did not write anything down. I know every single doctor, every single care, every single nurse. I knew everything from that day. But I don't want warriors to have to go through experiences like that where it then dawns on them to, okay, this is how you advocate for your rights. This is what you need to do. So maybe a module, because when I attended one of the leadership summits for sickle cell disease, there was a module they wanted us to test in one of the focus groups, which teaches people about the hierarchy in the healthcare system. So the attending doctors, the nurses, the charge nurses. So the hierarchy, knowing the hierarchy, patients knowing the hierarchy, it will help them know who do I go to when certain things are going on. Who do I go to that is over my attending doctor, or who is overseeing my charge nurse. So who to go to in hierarchy, a module sort of talking about that, and how to, again, like everyone has said, advocate for yourself properly within the healthcare system when things are going wrong, when you don't know what to do. That's what I think should be next.
Thank you so much. Really good addition of understanding just how the systems work. Great additional point. Kevin, I'd love to turn the mic over to you for your closing remarks and what we need to do to curate this space. The mic's yours.
Sure. I'm going to sound like a broken record here, but I think what has been said already is wonderful, and that is, we need to find ways to really elevate the patient voice. The patient voice is powerful, and if a patient is not empowered to elevate their voice themselves, we need to help educate patients on the processes that are in place already for them to receive better care and receive better experiences. There are different departments within a hospital that a patient voice can be voiced to for change to occur. Um, there's patient and family advisory councils that many hospitals have. I love the quote I always talk to other patients about. There should be no decision about me without me. And I think that really speaks to the power of the patient voice. That will help influence our healthcare system. We can also influence our education system with that. And then ultimately, we can also have great influence within our legislative systems and processes as well, so that we can have laws that are on the books to help protect sickle cell patients and help them get the care and receive things that are needed for them in their lives. So again, the various ways that we can help patients elevate their voice, I think, is crucial. Thank you.
Thank you so much, Kevin. And Shantana, I want to turn the mic over to you for your closing remarks and what we need to do to what we should be talking about and who we should have in this expanded tent. The mic's yours.
Thank you guys for having me. This is my first time participating, and it was really eye-opening, and I enjoyed the conversations. I would like to actually hear from college professors or from like instructors who teach curriculums and what goes into the curriculum that they have. Most of the first set of training is us sitting in classrooms as medical professionals, and a lot of the training doesn't, we don't get the proper training in school. And so then when it comes on to work, it's like it keeps passing down. So I would like to hear um, how they go about making decisions on what to teach, when to teach, and what they consider to be more important. But I also like what she said about being able to advocate and having a nurse tell her she has to leave after getting an opioid. Um, that's technically illegal and that shouldn't have happened to her, but she didn't even know that that wasn't supposed to happen. And that's the problem that we have, is that patients don't know what's supposed to happen and what's not supposed to happen. And so I think that's scary and frightening. And I'm sorry she had to go through that and that she got into an accident. But if a patient doesn't have a driver, we have to hold them for a minimum of 4 hours, because legally the hospital is responsible if something happens. But like she said, it's a protect your own kind of thing. And it's unfortunate. So advocacy and policies need to be shared all around. And that's all I have to say. And I want to say thank you again, everybody, for listening and having me.
Shantana, thank you so much. Maya, I'd love to turn the mic to you. Same question, closing remarks, and what do we need to do for next time?
Well, I just agree with what everybody is saying, and I think I really appreciate everyone being vulnerable and sharing your patient experience. Just living as a warrior, and it just shows that at the end of the day, you are your biggest advocate, and don't be afraid to speak up. No matter how much we educate providers, at the end of the day, even if you have the best doctor, you still are your biggest advocate, and you need to educate yourselves and feel okay and be okay to speak up, even if it labels you as a difficult patient. And if you feel like something is not right or something feels off and you're being kicked out of the hospital, ask to speak to the charge nurse, ask to speak to the patient representative, like fight for you to go to stay in the hospital. And if they discharge you, just go right back, because the hospital doesn't even get readmitted, get reimbursed for that second admission if you're admitted within a few days. But if you know something's wrong and something's not feeling right, speak up, because these ER doctors, there's no longevity to that relationship. They see you in the ER and that's it. It's very different than the type of relationship you have with your hematologist who follows you on the outpatient. So it's easy for them to just brush a patient off and not necessarily be compassionate unless they happen to be very compassionate people. So I would just, there's a lot of things that we need to do. And I just think at the end of the day, patients just need to continue to educate themselves and speak up. And if something doesn't feel right, take names down, report doctors, because if it's happening to you, chances are it's happening to other people. And we need to just keep calling out the elephant in the room and bring more awareness and education to get some change. So thank you guys for having me. It's been a really insightful conversation. I really appreciate everybody's personal experiences as a warrior, because at the end of the day, I learned so much as a sickle cell advocate from you guys.
Thank you so much, Maya. And Lupe, I'm going to give you the last word. Your thoughts, closing remarks.
Yeah, I love that Chris brought up social workers. And I think I mentioned this in one of the previous clubhouse meetings that we've had. I think social workers are definitely gems, especially like with the sickle cell community. They hold a lot of knowledge to things that, you know, can really benefit us in life. So I would like to see conversations with them as well. And then also I would love to see an inclusion of patients when it comes down to training healthcare professionals. So it's like one thing to learn about sickle cell from text material or maybe like a YouTube video or an article, but it's another to hear people's personal experiences with sickle cell. So whether that looks like patients coming into classrooms to share their stories, or being able to speak to hospital board members about sickle cell, or like, for example, I had an incident happened to me that led to me going into the hospital, speaking to like the head of the ER, the head of security, like the nursing supervisor, et cetera, et cetera. And even though there was a room full of different people and maybe only small percentage of those people really listened to my story and it made a difference, it still made some type of an impact. So being able to include patients in the education amongst healthcare professionals is something that I'm rooting for. And again, thank you guys for having this space for us.
Thanks so much, Lupe. I really appreciate that as well. And deep thanks.
Elizabeth,
Yes,
before you,
Sandra.
I'm sorry, I just didn't want them to forget. Before you close the room for tonight, I don't know if Donna or Renisha wants to mention the Pathways to Trust room that they're working on hosting. So if you can give it to either one of them and they can just enlighten everyone here and everyone that's listening on what they're working on, that will be wonderful.
Absolutely. By all means. I'll leave it. Donna, did you want to come off mute and address that?
Sure, no, that's fine. And Sandra, I want to thank you so much. You're like our agent. You're wonderful. Thank you. I appreciate all the support that you are giving to the work that we're doing. But yes, we are going to be starting a Pathways to Trust room towards the end of June. I will be posting the exact date because we're still trying to work it out with the moderators. But we will be addressing various issues around communication and how to restore trust with patients, with physicians, and marginalized medical populations. So we're hoping to bring some more rich dialogue and provide strategies and really, really hopefully good conversation because, as I said before, we like to find creative ways to talk about things that are real life but hard to believe experiences that we as patients have and work with physicians who understand and know how to help make healthcare better. So, we're all in this together. We're all trying to put the humanity back in healthcare, and there's a lot of challenges on both sides. And that's what we're hoping that our Pathways to Trust room will be able to do starting towards the end of June. So thank you again, Sandra, and thank you, everybody.
Yeah, and thank you so much. That's such an important discussion. If there's anything we can do to be helpful and support that, we'll be delighted to lift that far and wide in our network as well. Okay, so deep thanks to all of the panelists, everyone for the thoughtful engagement. We learn a lot every time. We're looking forward to continuing. And with that, I want to just express deep gratitude to Spencer for helping pull this room together, and Glynis, who isn't with us tonight, but is part of the backbone. So Spencer, now back to you for your final announcements.
Thanks, Elizabeth. And thanks to everyone for coming to this space and sharing their experience and sharing their perspective. It's really important that we bring as many perspectives as we can to this complex issue. So deep thanks to everyone. In closing, I'm Spencer Gurley, ambassador at Consuli and host for this room. Just a couple of announcements. In addition to this room, we also host a room on long COVID, data dignity, and clinical trials. So we're going to start hosting rooms weekly now, or each one of those alternating each week. So we're going to have a lot of Clubhouse content. You can find us at consuli.net. For direct questions, comments, feedback, you can find my email, my profile, or find me on LinkedIn. Love to hear you. I'm super responsive. And, if you have ideas for this room, people you want to bring on next time, or ideas of conversation that you want to have, feel free to reach out. Be sure to, once again, follow everyone here today. And we can hope to kind of bring this community on Clubhouse together. For those that joined late and missed the opening announcements, Consuli is a public benefit company with a mission to enable individuals to participate in the data economy. We do this by operating a marketplace for members where we become their agent and assemble patients' health records, labs, prescriptions, wearables, quality of life surveys, etc. Importantly, members receive smart-matched, individualized offers from us for opportunities, including to participate in clinical trials and data trials. If you want to participate in a long COVID, sickle cell, or any clinical trial, you can sign up to be matched for a study at consuli.net. There's no cost to join our movement. I've also pinned to the top a survey for sickle cell patients to participate in future clinical and data trials. We have a number of trials underway with organizations such as Pfizer and Sanguine Biosciences. So if you or someone you know is interested in participating in sickle cell clinical and or data trials to help improve treatment options, please find the link survey to be notified about future opportunities. That's going to be the end of this clubhouse. Super excited to have everyone here. Going to be reaching out to everyone and talking about ways we can improve the next one. So I'm going to leave some music on and leave the room open for a bit in case people want to peruse people's bios, follow people. But until then, we'll see you at the next room. Thanks, everyone.